Welcome to the Victory Education Lounge. I am your host Maurice, and we're thrilled to have you join us for another exciting episode. Before we dive in, don't forget to like, subscribe, and leave a comment below sharing your thoughts or experiences. Your engagement helps us create more valuable content for you. Today, we're exploring part 128 of our series, the impact of bariatric surgery on insulin resistance. Bariatric surgery has emerged as a powerful tool in the fight against obesity and its related metabolic disorders, including insulin resistance and type 2 diabetes. Let's dive into how these surgical procedures can dramatically improve insulin sensitivity and overall metabolic health. Could a surgical procedure be a key weapon in the battle against insulin resistance? Today we're venturing into the fascinating world of bariatric surgery and its profound impact on insulin resistance. Bariatric surgery, or weight loss surgery, has steadily gained recognition as a potent tool in the fight against obesity and its associated metabolic disorders. Among these disorders, insulin resistance and type 2 diabetes stand out due to their widespread prevalence and the significant toll they take on overall health. Let's lay down some groundwork first. Insulin resistance is a condition in which the body's cells become less responsive to insulin, a hormone that regulates blood sugar levels. This can lead to elevated blood sugar levels, which over time can result in type 2 diabetes. Obesity is a major risk factor for insulin resistance and type 2 diabetes, creating a vicious cycle that's often hard to break. Enter bariatric surgery. These procedures alter the digestive system to aid in weight loss, either by restricting the amount of food the stomach can hold, or by bypassing part of the digestive tract to reduce calorie absorption, or a combination of both. But here's where it gets interesting. Bariatric surgery not only aids in significant weight loss, but also leads to rapid improvements in insulin sensitivity, often before substantial weight loss occurs. This suggests that the metabolic benefits of bariatric surgery extend beyond mere weight reduction. Several types of bariatric surgeries exist, each with its unique pros, cons, and impact on insulin resistance. Over the course of this video, we'll delve into 7 of these surgeries, exploring how they work, their potential benefits, and the risks involved. So buckle up and get ready for a deep dive into the transformative world of bariatric surgery. As we navigate this journey, remember that every individual is unique, and what works for one may not work for another. Always consult with a healthcare professional before making any decisions about your health. Let's uncover the transformative powers of bariatric surgeries on insulin resistance. Our first stop is the Roux-en-Y gastric bypass, a popular choice with profound effects. This procedure involves creating a small pouch from the stomach and connecting it directly to the small intestine, bypassing a large part of the stomach and the first part of the small intestine. The pros of this procedure are apparent rather quickly. Patients often experience a rapid improvement in insulin sensitivity, which can lead to significant and sustained weight loss. In many cases, this procedure can even lead to the remission of type 2 diabetes. However, as with any surgical procedure, there are risks. Due to its complexity, RYGB carries a higher risk of complications compared to other bariatric surgeries. It can also lead to nutrient deficiencies due to the bypassed portion of the digestive tract. Despite these risks, studies show that up to 80% of patients with type 2 diabetes experience remission after RYGB. RYGB offers rapid and significant improvements, but it's not without its risks. Next, we delve into the simpler yet effective sleeve gastrectomy. This procedure involves removing a large portion of the stomach, leaving a banana-shaped section that is closed with staples. The result? A smaller stomach, restricting the amount of food you can consume and thus aiding in weight loss. But what about its impact on insulin resistance? Well, this is where it gets interesting. Sleeve gastrectomy has shown to improve insulin sensitivity, often leading to a significant reduction in the need for diabetes medications. Not to mention, this is achieved often before substantial weight loss takes place, suggesting that the procedure has a direct metabolic effect beyond just calorie restriction. However, it's not all roses. While simpler than Roux-en-Y gastric bypass, sleeve gastrectomy is irreversible. Moreover, it may not be as effective in achieving diabetes remission as some other procedures. But as a less complex option with notable benefits, it's definitely a procedure worth considering. Adjustable gastric banding, a more flexible approach to bariatric surgery. This procedure involves placing an adjustable band around the upper part of the stomach, creating a small pouch that can hold only a small amount of food. The size of the opening to the rest of the stomach can be adjusted by filling the band with saline, which is injected through a port placed under the skin. The beauty of adjustable gastric banding lies in its flexibility. The procedure is reversible, and the band's tightness can be adjusted based on individual weight loss progress and comfort. It's also associated with a lower risk of nutrient deficiencies compared to more invasive surgeries. However, it's important to note that weight loss with gastric banding is generally slower and often less dramatic than with other procedures. While it can improve insulin sensitivity, it's typically less effective for diabetes remission than other procedures. Gastric banding, slower progress, but with fewer risks. Now let's explore the most complex but highly effective BPD-DS. Biliopancreatic diversion with duodenal switch, or BPD-DS for short, is a two-part procedure. First, a sleeve gastrectomy is performed to reduce the size of the stomach. Then, a large portion of the small intestine is bypassed, dramatically reducing calorie absorption. The pros of this procedure are substantial. It's the most effective option for both weight loss and diabetes remission, leading to significant improvements in insulin sensitivity. However, it's not without its cons. It's the most complex of the bariatric procedures, carrying the highest risk of complications. Nutrient deficiencies are a real concern due to the extensive bypass of the small intestine. In terms of its impact on insulin resistance, the results are remarkable. Some studies have shown diabetes remission rates of up to 95%. But remember, with BPD-DS, the most dramatic results come with the highest risks. Next, the SADI-S, a novel approach combining the best of two procedures. The single anastomosis Duodeno-Ileal bypass with sleeve gastrectomy, or SADI-S, is a relatively new entrant in the world of bariatric surgery. This procedure involves a sleeve gastrectomy, similar to the one we discussed earlier, combined with a bypass of a significant portion of the small intestine. This dual approach aims to maximize the benefits of both restrictive and malabsorptive techniques. The upside? SADI-S has shown to be effective for weight loss and improving insulin sensitivity. However, as a newcomer, SADI-S doesn't have as much long-term data compared to other procedures. And just like other bypass surgeries, there's also a risk of nutrient deficiencies. Early studies have shown promising results, with diabetes remission rates similar to the Roux-en-Y gastric bypass, hovering around 75 to 80%. So the SADI-S, a promising newcomer with exciting potential. Our journey concludes with the mini gastric bypass, a simpler alternative to the traditional procedure. This procedure involves creating a small stomach pouch and rerouting the small intestine to this new pouch. The mini gastric bypass is a quicker operation with a shorter recovery time compared to its traditional counterpart. The pros of this procedure include its simplicity, rapid weight loss, and significant improvements in insulin resistance. It's a powerful tool that can potentially lead to remission of type 2 diabetes in many patients. On the flip side, the mini gastric bypass is not without its cons. It's irreversible and carries a risk of nutrient deficiencies due to the bypassed portion of the digestive tract. Also, it might lead to bile reflux, which can cause gastritis or ulcers in the new stomach pouch. However, studies indicate that the benefits of mini gastric bypass, like improved insulin sensitivity and weight loss, often outweigh the potential risks for many patients. Mini gastric bypass, a faster procedure that doesn't skimp on effectiveness. We've journeyed through the world of bariatric surgeries and their impacts on insulin resistance. From the Roux-en-Y gastric bypass with its rapid improvement in insulin sensitivity and significant weight loss, to the adjustable gastric banding, offering slower but still impactful metabolic improvements, each procedure presents unique benefits and considerations. We've also delved into the sleeve gastrectomy, a simpler procedure that preserves normal digestive tract function while effectively promoting weight loss and insulin sensitivity. However, it's not reversible and may not be as effective for diabetes remission as some other procedures. Then, there's the biliopancreatic diversion with duodenal switch, a more complex surgery that has shown the highest rates of diabetes remission and significant improvements in insulin sensitivity, but also carries the highest risk of complications and nutrient deficiencies. We also considered the single anastomosis Duodeno-Ileal bypass with sleeve gastrectomy, a relatively new procedure that combines the benefits of sleeve gastrectomy and malabsorptive procedures, but with less long-term data available. Lastly, we touched on the mini gastric bypass, a simpler and faster procedure than the traditional RYGB, but with its own set of pros and cons. In essence, bariatric surgery holds the potential to significantly improve insulin resistance and metabolic health. However, Each procedure has its unique advantages and drawbacks, emphasizing the importance of personalized medical guidance. It's crucial to remember that the effectiveness of these surgeries can vary greatly among individuals, and success often depends on long-term lifestyle changes in addition to the surgery itself. Bariatric surgery is not a magic bullet, but a tool that, when used correctly and in the right context, can dramatically improve the lives of those struggling with obesity, insulin resistance, and type 2 diabetes. It's a testament to the power of modern medicine and its ability to transform lives. In conclusion, bariatric surgery represents a powerful intervention for severe obesity and its related metabolic disorders, including insulin resistance and type 2 diabetes. While it comes with risks and requires significant commitment, for many individuals it offers the potential for dramatic improvements in health and quality of life. As with any major medical decision, careful consideration and consultation with healthcare professionals are essential. Thank you for joining us in the Victory Education Lounge. If you found this video helpful, please give it a thumbs up and share it with friends who might benefit. Don't forget to subscribe for more content on health, wellness, and personal development. Until next time, stay informed, stay healthy, and keep striving for victory in all aspects of your life. Disclaimer: the information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decision should be discussed with a licensed physician or qualified healthcare professional, especially if you have existing health conditions or are taking medications.